charge of activities, and it's just nice to have. Oh yeah, yeah. Testing, testing, testing. All right, I think we're ready to launch here. Okay, if I could have your attention. Thank you, everybody, for showing up. And because Dr. Andonian has an important message for all of us, whether you have rheumatic disease or rheumatoid arthritis. If you're a normal, healthy, aging person, I think he's got a message for you. So I think all of us are aging, some of us more than others, but here we are. My name is Melissa McLeod, and Dr. Andonian is here from the Center of Aging. And the focus of his research is basically how diet, exercise, training, and lifestyle changes, can have beneficial effects on the immune health, joint health, and overall health of people with rheumatic disease as well as rheumatic arthritis. And the goal of his research is to improve outcomes of patients with chronic inflammatory diseases of aging. He is a clinician and scientist at the Center for Aging, so please give him a warm welcome.
All right, thanks, Melissa. Thanks for everyone coming. Um, as mentioned, I'm a rheumatologist at Duke, and focus of my research and practice is really what we're going to talk about today, which is really lifestyle medicine and then exercise, but specifically how that relates to aging in general, which we'll talk about the biology of aging. So hopefully people are in for a science talk today, and but also for arthritis, because as a rheumatologist, I treat patients with arthritis of all kinds. That includes rheumatoid arthritis, gout, osteoarthritis as being the more common form of arthritis. So hopefully this will be useful for all of us, even if you don't specifically have arthritis. I'm really talking about really chronic conditions of any kind and how this could apply. My background, importantly, is that before med school, I worked as an athletic trainer and a sports performance trainer. So the ATC you see on my title stands for Certified Athletic Trainer, and so I really try to bring my past life and exercise science into my current practice and research in rheumatology. Uh, Disclosures, just to mention that I do get support from the National Institute on Aging, and I'm really thankful for their ongoing support of my research. Let's see if the slides move ahead. A couple things I just wanted to highlight that I want to get across today. As I said, I want to talk about the biology of aging. So I think everyone should come away with some understanding of why we age and what goes into it, at least at the molecular or cellular level, as we would say. And then talk about how lifestyle medicine might play a role in that, and specifically how it might affect arthritis. And then I'll give you some tips at the end, things that I talk about with my patients all the time. Start with a case. We often start our presentations with a case of a patient, and our patient M has kindly allowed me to use her face in her case. I think it's really important to really show how what I'm talking about fits into actual patients that I see in the clinic. So, patient M is 79. She has rheumatoid arthritis, but also has osteoarthritis, and we'll talk about some of the differences here in a bit. Has other comorbidities as atrial fibrillation. It should say osteoporosis instead of osteoarthritis again. But she also has this, what I call frailty. And in clinical medicine, we define frailty in a lot of different ways. But how I think about it is really what we're showing here, which is having weakness, fatigue, or exhaustion, slowing of the speed at which she walks, and then this low physical activity level. To me, this is what frailty is in terms of how we define it in the clinic. She also has active arthritis, and this DAS-28 or disease activity score is just a marker of inflammation and how much arthritis is active when I see patients in the clinic. And she has ongoing pretty active arthritis. Multiple joints are swollen and tender and giving her a lot of trouble. And ultimately, this patient global assessment here, a score of 79, is really poor, meaning 0 would be perfect. She's doing as well as possibly could. 100 would be the worst you possibly could. 79 is overall not doing very well. So question I have, because a lot of my patients come to me and say, I feel really bad. Maybe I'm just getting older. That's just the common phrase that I hear in clinic. So the question I have for us to begin with is this age, and chronologic age would mean based on her birthday, she's 79. Is this just aging, or is this biological aging, which we'll talk about as potentially being something different than your actual birth date related age, or perhaps both? The short answer is that biological aging is not the same as chronologic aging. So even though you have a certain age based on your birth date, the age with your cells are working in your body can either be younger or older depending on a lot of factors. And there's a lot of study being done about how we define biological aging and a lot of markers that people are trying to use in the clinic to say, how old is someone? Say she's 79, but is her actual age based on the biology of her cells in her body, is it 80 or is it 60 or is it 50? There's a lot of ways we look at this. And this is just uh, a chart looking at a lot of factors that go into aging, at least the biology of aging. And we know that a lot of these things can contribute to the aging of our body more than just the age and the number itself. This comes from a study done in New Zealand where they tracked patients, or really a population of people in this town called Dunedin, for 50 years and really tracked blood, and a lot of other markers during that time. And they found that certain things were more associated with how fast they're aging within their cells. And so things like their, their body mass, so having low muscle mass was associated with more aging, or having a low fitness, so testing them on a treadmill and how fit they were, that was associated with aging. And then markers of inflammation also were associated with aging. So you can combine a lot of these factors together and get a biological age that may or may not be the same as your, what I say is chronologic age. I think of rheumatoid arthritis and really a lot of diseases I treat, really any kind of arthritis, as being a model of what I call accelerated aging, based on, again, biological age, not necessarily the years based on birth date. And some of the rationale is just based on things that happen during aging and things that we see even people who are younger who have rheumatoid arthritis. So, one thing would be having more heart disease or cardiometabolic disease that includes diabetes. Another would be having low muscle mass. So, patients with rheumatoid arthritis have low muscle mass. As we get older, unfortunately, we all lose muscle. It's just part of aging, but we'll talk about later. We might be able to do something about that. They have more fat versus muscle, kind of the ratio between fat and muscle is different. They have more bone issues, so osteoporosis is more common in rheumatoid arthritis. Uh, Also, as we age, our bones tend to get thinner. They also have more physical disability, problems with exercise, and for whatever reason, the last part wasn't coming up. But their immune system in particular, when we look at it really in the lab, looks much older than someone we'd expect based on a variety of factors. So I want to introduce this concept called the biology of aging, and we're not going to go into the weeds here, but it's a good to at least know what we're learning, and we're constantly learning more about why we age. And this wheel highlights a lot of those factors that we're thinking are important. There's 12 that are listed up here, and I feel like every year we're adding more and more to the list of things that are causing our bodies to age, or things that are going on in the cells. So if we look at those things, there's problems with our DNA and how we translate our DNA to make proteins. There's problems with how we make those proteins. This concept called proteostasis is just how we make proteins to just build up our body. And we should go through this process called autophagy to renew our cells and actually let our cells do the work that they're supposed to. And that can be altered with aging. A couple things here we'll talk about more: nutrient sensing and mitochondrial dysfunction. Nutrients just means that our cells need to be able to identify if we need more energy or less energy. So or say our muscles are trying to work, but there's not enough energy available, like glucose to make what we call ATP for energy. Our body needs to sense that and send signals to say, hey, we need more energy to do this work. That process can be altered with aging. Mitochondria, we'll talk a little bit more in depth as an example. But then things that I'm really interested in is that really all of these hallmarks of aging ultimately end up with inflammation. Inflammation is just our immune system being overactive and causing inflammation in multiple parts of our body where our immune system is potentially causing harm as opposed to helping our bodies, which we'll get into. This is another way of looking at the biology of aging, but it puts that into context a little better. This is just another chart looking at a lot of those factors that go into the biology of aging. But we know that all these factors are key in driving all of these different conditions that we're showing up there. So think about cancer, heart disease, stroke, lung disease, diabetes, dementia or cognitive dysfunction, osteoporosis or low bone health. All of these things are driven by these, again, the biology of aging. So the idea is that if we can understand what's actually going on in our body to cause these things, we might actually get therapies that are not just treating individual problems, they're treating us more holistically in terms of preventing or treating multiple things at once. The concept multimorbidity right here really refers to just having multiple diseases. So as we get older, our risk for multimorbidity or having multiple diseases at the same time goes up. We know that there are genetics involved, and then there's environmental risks. So things we're exposed to, like infections and pollution and the things we eat, are all part of this environmental risk. What I think is missing from this list, although gout is up there, is arthritis, because arthritis, both osteoarthritis and rheumatoid arthritis, is highly linked to all of these things as well. What might be a little different, though, is inflammation. So, of these hallmarks of aging, inflammation is maybe more important to driving autoimmune diseases, rheumatic diseases, and rheumatoid arthritis as being kind of a prime example there. This is another way of looking at the same stuff. I'm showing you a lot of circles here. But this figure is a little updated, and importantly, it does have osteoarticular disease or arthritis as part of it. So they're putting that in the model now. But the idea is, again, if we can understand what's going on at a cellular level, like within our body, that's causing all of these problems, then we could target those things. Again, not just to treat little problems, we can actually treat ourselves more holistically. This um, is really referring to trying to prevent this from happening. So if we can prevent it from happening in the first place, that would be the best. But I would also say, even if we're identifying any of these problems, treating it early is potentially going to be helpful. This concept is being referred to as geromedicine. So we're trying to, again, look at therapies to treat our whole body as opposed to just your heart disease or just your arthritis. So to me, this is where healthy living and healthy lifestyle comes into play. For example, exercise is really my area of focus. We know that exercise can affect all of these things. This is not in circular form anymore, but it's really listing all of those things that are going into the aging process. We know that exercise can affect each of those areas. And so it might be what we call a polypill. It can do multiple things in different parts of our body and actually have benefits that are beyond just being able to, say, exercise for longer and have better heart and lung function. We're learning more and more about exercise as affecting really multiple parts of our body, including our immune system, which is something I'm really interested in. That brings us to try to understand what lifestyle medicine is. I mentioned earlier that my practice is focused on lifestyle medicine, but the question is, what is that? And the figure on the left, I think, shows this well. There's 6 pillars of lifestyle medicine. One is diet or healthy eating. Another is physical activity and exercise, managing stress, forming and maintaining healthy relationships, improving sleep and sleep hygiene, and avoiding risky substances, for example, tobacco. On the right, we're seeing how I think lifestyle medicine integrates with the care of our patients more holistically, with the person being at the center. This is a concept in geriatric medicine called the 5 M's, where we really focus on 5 aspects of caring for our patients. The first, maybe, is the most important, and that's focusing on what matters most. So I hope that when you see your doctor, they're asking you, like, what matters most to you? Like, what would actually be beneficial about us helping your health to do any given thing? So it's trying to understand what's really helping our patients. There's other aspects that include trying to reduce medications. We know that a lot of our patients, when they get a lot of diseases, they're on multiple medications, sometimes 10, 15, 20 or more medicines that can have a lot of potential side effects. We think about mobility or activities, mentation, referred to how your brain functions, and cognitive health. And then that multi-complexity is just, again, having multiple diseases all at once. Why do we think about this in arthritis, at least from my practice? What's the rationale? This figure is showing a couple things that I think are important for arthritis, but then autoimmune diseases in general. We know that inflammation is particularly important here. So autoimmune diseases are really hallmarked by inflammation. Our bodies, at least in autoimmune diseases, causing our immune system to attack itself and cause inflammation in those places. And that inflammation in and of itself can lead to bad things like low muscle mass, low aerobic fitness, or we say cardiorespiratory fitness, and then just poor outcomes in general. We have a lot of drugs that we can use to take care of our patients, including glucocorticoids, think of like steroids like prednisone. DMARDs are these we call disease-modifying antirheumatic drugs, things like methotrexate, and then biologic drugs that can help inflammation, yes, but they have their host of side effects that we worry about, including immunosuppression, so lowering our immune system so that we're at risk for infections, and then further worsening metabolic disease and lowering muscle mass. So exercise and lifestyle can play a role because they could potentially augment the effects of being anti-inflammatory, improve the way our immune system works, and then prevent some of the side effects from our medications. Good. I said I'd come back to this point about arthritis and osteoarthritis versus rheumatoid arthritis because there's a lot of different kinds of arthritis and they're not all the same. I would say, just to put it simply, that it might be a perspective of how much inflammation is playing a role. That's why I put inflammation at the bottom line. Going from a healthy joint to a rheumatoid arthritis joint, there's much more inflammation involved in the rheumatoid joint. Now, osteoarthritis is the most common form of arthritis. I think most of us in this room have some osteoarthritis. I know that I do. It's really the wearing of the cartilage. So our cartilage helps cushion our joints as we're moving. And in osteoarthritis, that cartilage wears down. And when the cartilage wears down, unfortunately, we're not very good at regrowing cartilage throughout our lives. But we're actually pretty good at growing bone throughout our lives. So you can see in this picture even, there's some extra bone that is grown. So we call these bone spurs. Or if you think about patients who have arthritis, the joints get bigger because the bones get bigger. But it's really the cartilage that is lost. The bones are trying to take over what the cartilage did, but they don't do the same job, honestly. Rheumatoid arthritis is a little different. Although you can get wearing of the cartilage, it's more because there's inflammation. All this red is inflammation in the tissue around the joint called the synovium, causing really damage and destruction of the joint. And that's what's going to cause problems with rheumatoid arthritis. I said I wanted to go into a few of these in detail just to explain how lifestyle can really impact certain pathways within the biology of aging. And mitochondrial function is something I think you might hear about a lot, but maybe not understand what's going on. And so I want to at least talk about how mitochondrial function is important in aging and how we might be able to target that with exercise and lifestyle. Just as a brief overview, mitochondria shown here are really the powerhouses of the cell. So every cell in our body has mitochondria, except for platelets. Every other part of our body has mitochondria that needs that helps with making energy. So, for example, we use fat either from our diet or that we have stored in our body, and that fat goes into the mitochondria and essentially is made into energy called ATP. In this process called fatty acid oxidation, and that's one of the I think the primary things that the mitochondria do. They also do other things such as this release of mitokines. These are proteins that our mitochondria send across our body to communicate, often just stress within the cell. In aging, there's a lot of problems with mitochondria, including reduced mitochondrial turnover and then this concept of mitochondrial permeabilization, which is just that the mitochondria aren't renewing themselves and they're also just not working as well. So, what happens at the end of the day is reduced cellular fitness. And I like how there's a picture of a dumbbell on this model because think about exercise can help our body's fitness. Well, mitochondria are really important for this fitness in the cell, making energy to do the work that any cell does, such as a muscle needs to contract. We need energy from the mitochondria to do that. And if that's not working well, it's going to ultimately lead to inflammation. This says activation of the inflammasome, but just think of that, that's just inflammation in our body. So think about mitochondria not working, inflammation can occur because of that. We know in rheumatoid arthritis, some of the work we've done here at Duke and then others have shown mitochondrial dysfunction across multiple parts of our body. Here, I'm showing mitochondrial dysfunction in the RA muscle, but also immune cells in RA have mitochondrial dysfunction. And so if you look on the left, you're going to see a healthy muscle, so it's nice and big and red and strong. And it's really what I call metabolically flexible. And so this term, metabolic flexibility, refers to the ability just to use energy to do the work that it needs to do for any given task. So we're not going to go into a lot of depth with metabolism here, but there's two different pathways our cells generally use to do the work that needs to be done. One is glycolysis. So here, glycolysis is where we use sugar, like glucose, and that's really important for quick bursts of energy. Think about you need to all of a sudden run quickly or away from something. You need glycolysis, especially in our muscles, to be able to do those quick bursts of energy. Um, versus oxidative phosphorylation, or OXPHOS, is this the term we use, is really more of the sustained energy that we use over longer periods of time. Think about going on a walk for, you know, 10 minutes or more, or just strolling around your day-to-day life. You really need your mitochondria to use oxygen, usually using fat as the energy source, and then go through oxidative phosphorylation. And again, the flexibility is that depending on the situation, your body can use different energy pathways to do that. The RA muscle is very different. It tends to prefer glycolysis over oxidative metabolism, but it's not necessarily good at either. It's overall very poor at using energy. Um, and that's what then will manifest as weakness and having weak and small muscles. The immune system in RA is also very altered, and just as from a simplistic way of saying it, it's not really good at doing glycolysis or oxidative phosphorylation. It really is not good at producing energy to do the work it's supposed to as an immune system. It takes our glucose and really it takes the fat and then makes that into more cells. It's used to proliferate and cause damage in our joints, like allowing our immune cells to get into our joints and cause damage. So overall, just know that mitochondrial dysfunction is probably leading directly into a lot of problems, at least in rheumatoid arthritis, but in other diseases as well. So I was here, I think maybe 3 years ago. I talked a lot about some of the work we've done in exercise for patients with rheumatoid arthritis. And this is just a rehash of one of the things I talked about, which is we did high intensity interval training exercise program for patients with rheumatoid arthritis. And we did this on a treadmill. So we had patients with rheumatoid arthritis come into our fitness center at the Duke Center for Living. And high intensity interval training just means that they alternated between high intensity bouts, so they went faster on the treadmill or a higher grade, and then alternating with a lower intensity bout, so like every minute going back and forth. And this training program over 10 weeks, we found really improved mitochondrial health within our muscles, but also in immune systems of patients with rheumatoid arthritis. Um, there's other things we found. I'll talk about this study a little bit more in a bit. More recently, we completed a study also in patients with rheumatoid arthritis where we randomized or had them go to one of two groups. One group was an intensive exercise training program we called SWEAT, or supervised weight loss and exercise training was what SWEAT meant. So it was both aerobic training, so aerobic means getting your heart and breathing rate up, and resistance training, which is muscle strengthening exercises that we did with resistance bands, as you can see Kelsey doing here. And then the aerobic training was really following along to these videos and also working with the trainer via Zoom. It was a remote program that we implemented during the pandemic because we couldn't bring people into our lab. So we had to figure out how to do the program remotely, which I think was a blessing because we've I think figured out how to get this program to more people, and we're constantly trying to build it. But there's also a diet component to this program where they had a reduction in the calories that they were taking in. And so the whole idea was to lose weight while trying to get more fit through exercise. And we found that this program did a lot of really good things. But in terms of talking about mitochondria, we found that the program significantly improved fatigue. So at least our patients reported how much fatigue they had before and after the program. But it's also associated with mitochondrial health in general. And when I say mitochondrial health, there's multiple ways we can measure mitochondrial health. One is just your overall fitness, or your VO2. It's really a marker of how well our mitochondria are functioning. We also can see mitochondrial health within our muscles that we measured, but then also in our blood. And a lot of markers were showing that the mitochondria are functioning better. So directly related to fatigue. So this told us that fatigue is more than just something you feel. It's actually something going on directly in our cells that things like exercise can improve by improving mitochondrial function. So something we really want to learn and understand better. There we go. Next thing I want to talk about, at least when it comes to lifestyle medicine, how it relates to aging biology, is something called dysbiosis. And this really is also referring to gut health or improving our microbiome. A lot of different terms are being used, but it's a fairly hot topic in general, so I thought it'd be good to talk about it today. Dysbiosis really just refers to the bacteria or the microbes that we should have working with us in our body can be altered. So, one thing to know is that we have bacteria all over our body, and it's not necessarily a bad thing. These bacteria are living with us in harmony on our skin, in our lungs, and especially in our gut. And the gut is probably the place we understand it the most. But important to know is that we really need a variety of what we call good bacteria living in our gut to make up our microbiome. And when we don't have that, we have some of the bad players growing instead. That can cause a lot of problems, and we know that that can lead to multiple health problems. Um, a few things to note is just uh, good bacteria can release molecules that go into our body and can help with signaling throughout our body to improve our health, something called short chain fatty acids, there's the SCFAs, among other things, are really important. If we're not getting that signaling, we can actually have a lot of problems, including all these things we're seeing here: obesity, diabetes, cancer, cardiovascular disease. And of course, inflammation is coming up again as something that can be affected. As you're getting the theme here, rheumatoid arthritis also is linked to dysbiosis, or having altered good bacteria in our gut. So in RA, we're seeing less diversity of the good things, and less amount of the good bacteria as well. And this is directly contributing to inflammation and then production of what we call autoantibodies, or antibodies our body makes that are against our own self. That's what autoantibody is referring to. So things called a rheumatoid factor and these ACPAs, or citrullinated peptide antibodies, are something we see in direct relationship to the dysbiosis. There's not a lot of great studies yet on how we can improve this, but in general, ways that we can help with our microbiome is through diet, as you might expect. This study continues to fascinate me, which I'll talk about here. One sec. This is a study out of Stanford a few years ago where they had overall healthy middle-aged adults come in to the study, and they were randomized into one of two groups. One group was this high fiber diet, and another group was this high fermented food diet. And so the high fiber diet, so think about getting us a lot of whole grains and vegetables that had a lot of fiber in it. They looked at a lot of markers and see how they did after I think it was 10 weeks as well. And what they found was that fiber actually had impact on the microbiome. And the reason is because fiber is essentially what we call prebiotics. So if you ever see that term, prebiotic is essentially fiber. Just a fancy word for it. Because our bacteria really need the high fibrous foods to really grow, and that's the energy that our bacteria use. So we found that the high fiber diet seemed to increase some of the we call microbiome function, these short chain fatty acids. What was really interesting is that inflammation changed depending on their baseline diversity of this good bacteria. So those who had really poor or less diversity at the beginning, if they gave them a high fiber diet, inflammation went up. So you were basically feeding into all of the bad bacteria, and inflammation actually got worse. Versus those who had a lot of diversity and a really healthy gut to begin with, you give them a high fiber diet, inflammation actually went down. So it depended on the situation. In contrast, the high fermented food diet, the whole idea here is you're trying to get a lot of diverse uh, microbes into your system. So I think they had essentially like three meals a day where they had at least some sort of fermented food. So, for example, for breakfast, you had Greek yogurt or kefir, another fermented dairy product. For lunch, you might have had a kombucha tea or another tea or another drink that had some fermentation to it. And then at dinner, maybe you had some sauerkraut or kimchi. That's the kind of foods I'm talking about in terms of um, fermented foods. And this increased diversity of microbes and also led to decreased inflammation. Or sorry, yeah, increased diversity, less inflammation from that. So we don't have great data, as I said, yet on arthritis and say rheumatoid arthritis, but there's enough growing here that I think potentially this is a way to combat inflammation is through trying to improve diversity in our microbiome. Next, we'll go to inflammation, because I already mentioned that inflammation seems to be one of the biggest things we're dealing with in terms of why we get a lot of chronic diseases, including arthritis. But especially as a rheumatologist, really all of what I treat is patients who have inflammatory diseases. And there's this concept that I think this group would be interested in called inflammaging. That we're learning about how inflammation just contributes to so many things with aging, particularly biological aging, not chronologic aging. But it's really referring to this chronic low-grade inflammation. And that's measured in a couple different ways. We have what we call inflammatory markers we measure in the clinic, things like a C-reactive protein, and then these cytokines called like TNF alpha and IL-6 are inflammatory proteins that we measure. These are linked to aging. But also, all these diseases, at least the ones we're talking about in this diagram, all have inflammation as a key part of why they occur. So that's why this term inflammation is becoming more and more popular, with the idea that if we can combat that kind of inflammation, we could again treat multiple different diseases at once. What I say is disease agnostic therapy. Um, arguing that we have therapies that we could target these things, and diet and exercise in particular could be utilized here. This figure is showing what I've already discussed in terms of all of these hallmarks of aging. It's not the circle anymore, it's just the list of these things. I'm showing you multiple different things showing the same stuff, but all really coming to inflammation at the end. So all of those problems like dysbiosis and mitochondrial dysfunction, at the end of the day, they're really causing inflammation. So that's why the gas can is what's shown there. And then the fire. And the question for us as a medical community is, what are the anti-inflammatory interventions we can do to help this problem? And I find this figure fascinating because we use a lot of these therapies in rheumatology, such as TNF inhibitors with things like etanercept or Enbrel, adalimumab or Humira are medicines we use to treat rheumatoid arthritis and a lot of other therapies. It's interesting to think about these medicines being used in other contexts, but I would argue that unfortunately these medicines have a lot of side effects, and particularly decreasing immune function and putting people at risk for infections. So I'm not sure that's necessarily the way to go. Which brings me to lifestyle again. Can we alter the way we live to actually help with inflammation? And this is, I think, a good study to talk about, at least to begin with. This is called the calorie study. So it's a study of caloric restriction. Caloric restriction means that participants in this study were randomized to a caloric restriction group where they decreased the amount of calories they took in per day, ultimately only by about 10% from where they were before. So think about you're currently eating like 2,000 calories a day, reduce that by 10%, that's just reducing by like 200 calories. So maybe a bag of chips, or even a half a bag of chips, actually. Um, but if you do it over 2 years, it has a lot of potential benefit. And this figure, at least, is showing that the pace of aging in the caloric restriction group in the blue triangle, the pace of how their biologic age that we talked about earlier, it didn't go up as much. It still went up at 24 months or 2 years, but not nearly as much as the group who just had their regular diet and they kept eating the same way. So there is some thought that potentially just reducing the amount of calories we take in can actually improve biologic aging. And a couple things were fascinating to me about this study. You would expect that if you took in less calories through your diet, you would lose weight, and some did. But there was really no relationship between the benefits in biologic age to weight loss. So weight loss was really not the driver in multiple different ways you look at the data. So there's something more beyond just losing weight that reducing calories potentially benefited people in this study. We also found, as I showed here, is that those improvements in biologic aging were strongly linked to improvements in inflammation, and different markers in the body, these proteins that cause inflammation, went down in that group who had the lower calories. So we're thinking this is at least one way to think about it. Just reducing the amount of calories, even by a little bit, could have a benefit down the road. Going back to some of the work we've done at Duke in rheumatoid arthritis, we know that exercise and diet can also improve inflammation. The first figure here is from that high intensity interval training study, where, again, they did the treadmill training program for 10 weeks. We found that inflammation across multiple measures, including this disease activity score, DAS28 just stands for disease activity score. And so they had less swollen joints, less tender joints, improved inflammation overall. And this was also linked to improved immune function, which I thought was really interesting. I talked about this, I think, last time I was here, but their immune cells, so their neutrophils and macrophages, were just working better. They were doing more of what they were supposed to do. And then the mitochondrial function, as I mentioned briefly, within the T cells, another immune cell, also improved in association with their fitness improving. And then this is referring to that sweat study. So supervised weight loss and exercise training also found, compared to a counseling group, this chat stands for counseling health as treatment. They did a exercise and diet counseling for just 1 hour at the beginning of the study, and then they kind of went off on their own to do the exercise program. This is showing that a supervised program was probably better than just a non-supervised program, at least in terms of improving inflammation, which is that disease activity score. So we're seeing in multiple places where diet and exercise can improve inflammation. I don't want to neglect the other aspects of lifestyle medicine to say that diet and exercise are great, but there are other aspects of improving our health that we should consider. Stress and stress management is one that I think we often neglect. And there's a lot of programs to consider how we can reduce stress. I always talk to my patients that there's no way to prevent stress in our lives. It's just, it's there. We have different ways that we can help manage it or at least deal with stress as it comes. And the most, I think, popular these days are things called mindfulness programs, if you've heard of those. So, this was a study of mindfulness based stress reduction. So, it included a program with mindful meditation and then yoga, so including some mind body activities. And this program was 2 months, I believe, but at 6 months, there was a lot of improvement in inflammation. And this is just a tender joint count, as one example of less joint symptoms, so less arthritis symptoms after that period of the intervention. And there's other studies in other populations of people that would also show that improving stress management can help with markers of inflammation. So, stress management, I think, really should be considered whenever we're talking about kind of a holistic plan of care. Relationships are interesting. We think that relationships are really important to our health, but measuring exactly how they're important are I think, tricky. This study at least was trying to understand how rheumatoid arthritis, or just a diagnosis of a chronic disease like rheumatoid arthritis, can impact families. So they did really large interviews with multiple patients with arthritis and their families, and just looking for themes about how this impacted them. So, for example, one theme was that relative or family member really has a new role now because, if someone close to you is sick with a disease that needs doctor's appointments and all of that, they're forced to really do a lot of different things in and around the house and just helping out with that person. Also impacts their relationship. Um, that can be both positive and negative. Sometimes a new diagnosis can bring people together, but also can lead to a lot of challenges that you weren't anticipating. Um, so that can impact the social aspect too. We know that patients diagnosed with chronic diseases often have less social interaction after that, potentially because you're focused more on trying to take care of yourself and the things that go into that. And the other point is that it's difficult to understand the needs of that relative who has that problem. So the idea here is that one, we should work on caring for our patients as a team or as a unit, but also kind of as this, I put that on the upper right, to show how this all works together. And we're thinking about, for example, changing your diet or exercising more. It's kind of hard if you don't have other people around you doing it. Meaning, if you want to change your diet and eat really healthy, but everyone else in your family or in the house wants to eat really, bad processed foods and such, it's really hard to make that work. And it's nice when you're starting an exercise program to try to have someone else doing it. So that's the other point that I wanted to make here. Sleep is also another area we don't think about enough in terms of how to improve sleep and how that can help our health overall. I'm just using the example of rheumatoid arthritis here again. Rheumatoid arthritis um, can impact sleep in multiple ways, as we're showing here. Up to almost 50% of patients with rheumatoid arthritis get less than 6 hours of sleep. And all of these things that I list up there are linked to a lot of bad things, including inflammation and pain. So, sleep is something really we don't think enough about. I'll go through pretty quickly some of these other things, but you'll have hopefully at least the presentation to take a look back on because I want to do save some room for questions. But diet is a huge area that we could probably spend another couple hours really talking about because there's a lot of thought on what is actually an anti-inflammatory diet. And here is a study that was done in patients with rheumatoid arthritis studying this anti inflammatory diet that includes a lot of the things here. It's increasing certain things and decreasing certain things. overall, think of this as mostly a Mediterranean style diet or a plant based diet, trying to reduce sugar and salt intake. Uh, whereas in place of sugar or salt, the seasoning or flavoring of food is going to come from healthy oils like avocado oil or olive oil, and then spices and herbs of all kinds, which leads a little bit into my next couple slides, which, let's see here. Sometimes the pictures aren't coming up. I'm always asked about what supplements can be helpful for patients with arthritis. And the best studied are probably two roots. Both turmeric and ginger have a lot of potential anti inflammatory benefit and have been studied in arthritis, multiple kinds of arthritis, to have help for that condition. The problem sometimes is that people think that these are completely benign, that you can take as much turmeric or ginger as you want, but there is some risks, as I put up here, especially those on blood thinners. You have to have some caution that taking too much turmeric or ginger can kind of lead to more blood thinning and put you at risk for bleeding. And those who have liver disease, also caution with taking too high a doses of either turmeric or ginger. I always put the plug for taking with black pepper because when we have turmeric in a supplement or cook with turmeric, it gets absorbed and utilized in our body better if there's black pepper present. To me, this has to do somewhat with why we combine spices and herbs together to begin with, and we've been doing it for millennia, right? But there actually seems to be health benefits to the combinations of spices that we use. And this is one example how black pepper and turmeric are used together. And pretty similar conversation about ginger. Intermittent fasting, I also hear a lot about this. We talked about how reducing calories might be helpful for our health and biological health. But intermittent fasting is the idea of having low calories at a certain point and then higher calories at other points. And that can mean this idea of time restricted eating is probably the most common form of intermittent fasting, when we're only eating during certain hours during the day. The most common one would be like this 8 hour window. So 16 and 8 diet, where you're only eating during 8 hours during the day. The next 16 hours, you're fasting. But there's a lot of different ways we can do this. The 5 and 2 diet is referring to 2 days during the week having a pretty low calorie diet. So you're only having really a couple hundred calories that day, and the other days you're eating as normal. And then other things like Ramadan fasting have obviously is its own thing, and then alternate day fasting is just every other day fasting. But we have seen some potential benefit. I get some of the references up there if you're interested. For example, studying patients with rheumatoid arthritis over Ramadan actually found that the fasting seemed to be linked to improved inflammation just during that period. And after going back to a normal diet, inflammation returned. So essentially, there's some things going on there, but there's some preliminary data showing ultimately that inflammation can be improved by a fasting program. I would caution anyone interested in this to really slowly get into this kind of program and not just start to fast for like a whole day at a time, because if your body's not used to it, it can be fairly stressful. So I'd say only do that for only a certain window, like try to increase the frequency of how many hours a day you're fasting. This is another plug just for how these things work in synergy together. So we know that stress management is helpful, diet is helpful, exercise is helpful, but when you combine them together, the benefit is probably even greater. So this was a study done in the Netherlands looking at this plants for joints intervention, which I like that name. It was a whole food plant-based diet, similar to the one that we briefly mentioned before. It's mostly Mediterranean style plant-based diet, physical activity program, and then a stress management program. And combining that together, really just doing 10 group sessions over the period of 16 weeks. And what they found again was inflammation really markedly improved in rheumatoid arthritis patients, perhaps to a greater extent than we'd expect from any of those interventions by themselves. This is just talking about what the next steps are in the field for me and others interested in it. Um, I'm part of this study called MotorPack that we actually recently completed the main part of the study, but this is really the largest exercise physiology study in history, and it was a NIH Common Fund project, which cost I don't know how many millions of dollars, but across multiple sites throughout the U.S. and led by a colleague of mine, Bill Krause at Duke, where we were trying to understand how exercise works. MotorPack stands for the Molecular Transducers of Physical Activity Consortium, and it's really exactly as it stands for. What are the pathways with exercise works? I can tell you that exercise improves immune function, but you ask even any doctor, how does exercise improve the immune function in our body? You're not going to get very clear answers because we don't know the exact pathways, like the molecular pathways that, like our immune system is talking to our muscles, for example. MotorPack is at least the first step to try to get there. We had over 1,000 participants throughout the country come and do exercise, either aerobic exercise or strength and resistance training type exercise. And we did muscle biopsies and fat biopsies, and we got blood and plasma before and after a bout of exercise, and then 4 hours later, then the next day, and after a whole training regimen over several weeks and months. So all of this data that we're trying to put together to see how the organs are talking to each other during exercise, with what we call multi-omics, or looking at how the proteins and the DNA is changing essentially with exercise. So hopefully we'll learn a lot to really help understand exercise and apply it to um, my interests, particularly how it affects the biology of aging. Last few minutes, just to give a few tips. Again, I want to go through quickly so we have some time for questions. But putting this to practice, we all need to think about how we can find ways to be active. And there's some recommendations I put up here in terms of aerobic and strength training. But ultimately, it's just finding what works for you. I know at least here you guys have awesome facilities that I'll hopefully check out maybe once we're done. But there's a lot of ways, for example, to do aerobic exercise. And we always think about walking as the classic form of aerobic exercise. But I would argue that walking is not the best form of exercise for everybody. I have a lot of patients with lower extremity arthritis, so ankle and knee and hip, and then even low back arthritis, where walking is a lot of stress on their joints and it can be very challenging. And my recommendation would be consider some lower impact exercise, whether that's cycling, like biking, or getting on an elliptical machine, whether that's a upright bike or recumbent bike, and then anything in the water, whether that's water aerobics, water walking, or swimming. Strength training to me is something that's really underutilized. It really is the best way to build muscle. I mentioned earlier that we all lose muscle with aging unless we do something about it. And that doing something about it is really strength training, which can come in a lot of forms. It can be going to the gym, using weights, using machines. I mentioned for our studies with rheumatoid arthritis, we use resistance bands because they're easier to handle resistance bands with people who have arthritis of their hands. So there's different ways to approach it. And to me, it's just starting to learn some of the exercises and very slowly building up over time. There are other things that go into exercise program. I really talk a lot about how flexibility and balance training can be important. Uh, this often is including things like mind-body exercise, which often to me is going to be one of these things. So yoga, tai chi, Pilates, really is working on mobility and balance and strength all together. And then there's the stress management aspect of it in terms of deep breathing exercises, which we'll talk about here soon. This is, I think, a conceptualization of how we think about anti-inflammatory diet. In particular, colleagues of mine at the University of California, San Francisco, actually the Osher Integrative Medicine Center. So I think it's the same Osher as the lecture series here. They have put together a lot of good information about what is an anti-inflammatory diet for patients with autoimmune and inflammatory diseases. And so there's a lot of good information of just putting it together into this anti-inflammatory food pyramid. Talk about sleep a little bit. A A lot of things go into sleep hygiene that I put on here in terms of keeping your schedules the same. Our body and our circadian rhythm really like consistency of going to bed at the same time, waking up at the same time. But especially on my patients with arthritis, sleep can be difficult for a variety of reasons, including pain at night and stiffness. And trying to figure out how to manage that can be challenging. And that's where actually exercise comes in. Actually, we know that exercise can help regulate our circadian rhythm and actually can help with stiffness. But I like to recommend more and more this last point, which is considering light exercise or a mind body type exercise like yoga or Tai Chi, not with the goal of getting your heart rate up, but really just to work on getting your body more mobile and flexible before bed. Most of us, I would say, in the hours before bed are pretty sedentary, meaning we have dinner, maybe the next couple hours either watching TV, reading a book, and then we're going to be sedentary again for the next 8 hours or more if, in bed. All that time put together can put just impact on your joints in terms of causing more stiffness and pain. So if we can break up that cycle with a little bit of light exercise before bed, it can prepare our mind and our body for sleep. Stress management, another big topic, and mindfulness training is something to really think about. To me, mindfulness training is just trying to focus on being present in the moment. And there's different ways of doing that through meditation, journaling, and there's other options. Deep breathing exercise is the most common way of thinking about it. For example, box breathing, if we've heard of this, is just a way of at any moment in the day feeling stressed or just trying to work on keeping calm for whatever reason, doing a 4 second breaths is really what it is. So 4 second breath in, so and then holding for 4 seconds, and then 4 seconds out. Hold for 4 seconds, and then breath again. So that box is what the box breathing is. And that really forces you to think about your breath and focus in on the breath and let everything else go. I think there's a lot of benefits just from learning those kind of simple techniques. I'll finish up with our patient again, Miss M. This is 3 years after we first saw her. So instead of 79, she's now 82. This is also 3 years after she participated in that SWEAT program, so the supervised weight loss and exercise training. And as she continues to tell me in the clinic, it really changed her life. And this is just one way of looking at it. For example, she's really changed the way she takes medications for rheumatoid arthritis. She was on this biologic drug, this TNF inhibitor called certolizumab. She's reduced the dose of that. Another medicine called hydroxychloroquine, she's completely stopped. I would no longer classify her as being frail. She's improved her muscle mass and strength, her VO2 or her fitness, her walking speed. She's much more physically active, doing all the things that she wanted to do. She actually got an injury from riding an ATV because she couldn't ride an ATV for obviously many years before this, but she recovered from it, which is something we call resilience. But that was really made me happy that she was able to do the things she wanted to do. And then as far as rheumatoid arthritis, her disease activity is now 1.3. She's in remission, and her global assessment is now 0. She is doing excellent. So, did we decrease her biologic age even though her chronologic age went up? I would argue yes, but things for us to think about. So the final points is that just understanding that we're better appreciating what goes into the aging of our bodies, and things like mitochondrial dysfunction, dysbiosis, inflammation contribute to all sorts of chronic diseases, including arthritis. Lifestyle medicine really can impact our bodies in multiple ways. This includes physical activity, healthy eating, managing stress, improving sleep, and maintaining healthy relationships. Potentially, what I call gerotherapeutic lifestyle interventions really can target biological aging and potentially help with arthritis and really chronic disease management. So, thank you all for listening, and thanks to all my colleagues and collaborators. This is our team over at the Center for Living. My collaborators, Bill Kraus and Kim Huffman, are really key in all this work, and then really thankful for the funding I've gotten both from the NIH and the Duke Aging Center. So, thank you guys. So we are at the hour, but I'm happy to answer some questions for a few minutes if anyone wants to stick around.
As far as diet is concerned, we are a captive audience here. And I wish our nutritionists and chefs were here at this time because the diet we get here is not healthy according to what you've reported. What could we do?
Yeah, I think it's a great question, and we all got to make small changes, right? I think talking about big groups of people like yourself or any individual, when I'm talking to a patient, we can identify the quote unquote perfect diet. That really doesn't exist. And I think the point should be that everyone has different preferences and there's different things culturally that we need to think about when it comes to diet. So whenever I'm talking to my patients about these things, we got to think about what kind of small changes can we make. So for here, I would